Let me just share my screen here. Hold on. Okay. So good evening, everyone. My name is Dr. Chris Maria Cristina Guzman. I'm the Clinical Support Manager for Southeast Asia from Smartee Denti Technology. And for this evening, we will be discussing all about Smartee. This is the Smartee Basic Training course. So before I begin, let me introduce myself. I started doing the Smartee certification course back in Manila in 2021. And we've been doing the Smartee conferences back then since 2021 up to 2024 before I joined Smartee directly. And I was also invited to do the lecture for the International Association for Orthodontics Philippine section to discuss about the mandibular repositioning, as well as the Philippine Dental Association scientific seminars. And since 2024, since I joined Smartee, we've been attending these GS conferences in different countries such as Singapore, and we also attended the Smartee exhibition back in Taipei, Taiwan in 2024 too. And I also did the Smartee Dental Congress lecture back in March 2025 in Almaty, Kazakhstan. And I also did the launch talk during the AOSC 2025 in Singapore and attended the Smartee GS conference in University of Sydney in Australia. And just recently, I was invited to do a lecture for the Taiwan Academy of Comprehensive Dentistry for the Smartee training course, and also at the Manila Central University in partnership with the Association of Filipino Orthodontists for the mandibular repositioning technology too. So let us now begin our basic course with clear aligners. Let us first understand what are clear aligners. So clear aligners, these are transparent, flexible plastic form of orthodontic devices that fit tightly over the teeth to reposition and correct the misalignment. So this is a series of customized trays that are used to move the teeth in increments according to the treatment plan designed by the dentist. So by the meaning itself, designed by the dentist, meaning to say that the treatment plan will be based on the doctor's preference. Now let us determine what is the difference between having metal braces and having the invisible aligners. As for the appearance, definitely invisible aligners by the name itself, invisible, and not like the metal braces that are visible, our aligners are food-grade plastic material. Now for the application method, for invisible aligners, you are supposed to wear it within 20 to 22 hours a day. As for the metal braces, it is fixed and should be worn 24/7. For the oral care, generally for invisible aligners, it's easier to clean because you can remove the aligners and clean as is using the floss or just a normal toothbrush. As for the metal braces, it may require special brushes and flossing techniques. And for the chairside or appointment visits for invisible aligners, it is less frequent, like 6 to 8 weeks or every 2 or 3 months. As for the metal braces, it should be at least every month. And appointment duration, it's less for invisible aligners, but more for metal braces. So again, here are some of the benefits of doing clear aligner treatment. It provides invisible treatment, and that is what separates clear aligners from other forms of teeth straightening, including the metal braces. It provides invisible wonder. Easy maintenance because it's easier to clean. It's more comfortable because the patient will not experience really pain, especially when during adjustment. This is staged, so every week of replacement, it is comfortable, and there's no diet restrictions for your patients. It's foodie friendly because they can just remove the aligners and eat as is. And it provides a better smile and faster treatment because we are using the AI simulation to predict the movement. So here are some of the benefits of clear aligners. For the patient, it is customized and aesthetically pleasing. It's comfortable and removable. It's good for oral hygiene maintenance, and it provides optimum orthodontic force as well. It is controlled, programmed tooth movement, visualization of treatment results, and it can improve the quality of life because patients don't have to go to the clinic often as with metal braces. And as for the doctor, the benefit of clear aligners is that there is precise control of tooth orientation because of the 3D treatment plan. And it also provides good oral hygiene maintenance for your patient and reduces the incidence of demineralization in them, reduced chairside time, and fewer follow-up with the patients. So here are some of the indications for clear aligners. We can do mild to moderate up to severe dental crowding, spacing, deep overbite, bimaxillary protrusion, even with extraction or non-extraction of premolars or wisdom teeth, implant space adjustment, patients with mild periodontitis, orthodontic relapse, pre and post orthodontic treatment in orthodontic surgery, final tuning or refinement in the final stage of orthodontic treatment, and in correcting bad oral habits. So how do you choose the right patient? I know that Smartee has a lot or have diverse product options. So first things first, in choosing the right patient, you need to know if the patient will be compliant in wearing them. Why? Because like what I've mentioned, patients have to wear the aligners at least 20 to 22 hours a day. Now, the second consideration in choosing the right patient is that the patient should be able to come for a follow-up visit. Not as often as with metal braces, but at least they need to go for follow-up visits. And third consideration is for the oral hygiene. Even though that they can brush as is, they have to remove the aligners to brush completely. Well, they have to still maintain good oral hygiene. And also have to check if they have implants, if they have periodontitis, how bad are their gingivitis, restorations, because those are you need to consider in choosing for clear aligner treatment. If this will be your first time to do clear aligner treatment, it's best to start from easy to moderate before jumping to the difficult or the expert level. For simple cases, these cases are highly predictable, meaning to say that we may be able to achieve the target position in just the first sets, or we may only use about 1 up to 2 refinements to be able to achieve the good treatment outcome. So what are those simple cases that are highly predictable? So number one, these are adult patients with clinical crowns or sufficient height for good fit. We may be able to close diastema or spacing for simple cases, mild or moderate dental crowding without changing the facial profile, or the treatment of lateral labiobuccal flaring arches up to 2 millimeters, torsion of incisors to gain clearance, or cases with mild anterior dental crossbite, or even the mild dental class 3 malocclusion cases, and non-extraction cases with shallow overbite. So here are some of the indications for simple cases. Now, the moderate cases, these are moderately predictable. So you may use about 2 to 3 refinements with this one, and examples of which are root-controlled movements, or for cases or treatment requiring intermaxillary traction, for treatment of molar movement up to 2 millimeters distally, or cases with poor periodontal conditions, adolescent cases with sufficient dental crown eruption height but poor cooperation, or non-extraction cases with mild anterior open bite that requires anterior retraction. So here are some of the examples of moderate cases. Now for complex cases, these are less predictable. That's why we will be needing more refinements with this one. So examples of which are for cases that requires treatment of severe torsion in the premolar and lower canines, cases with premolar extractions and posterior teeth mesialization, treatment for patients with clinically short dental crowns, or who are not good with wearing the fixed orthodontic appliance. So for class 2 deep overbite that requires extraction of the anterior teeth, we can also do treatment for extraction cases with moderate anterior open bite that requires anterior retraction, or severe buccolingual inclination of the posterior teeth, or the combined orthodontic and orthodontic surgery treatments. Now, before we go into the details about Smartee product series, you may be wondering, when did clear aligners start, or what is a brief history of clear aligners? Well, back in 1945, that was the invention of the tooth positioner. That concept of invisible orthodontics was proposed by the American dentist, Dr. H.D. Kessling, 1945. He introduced this concept as step-by-step tooth positioning, and he called it the tooth positioner, or TP. And that is used as a retainer for minor adjustment in tooth position. So typically, it's made of soft rubber or elastic plastic that covers the crowns of all the teeth in the dental arch. Now, in 1971, that was the birth of the first transparent orthodontic appliance by American doctor R.J. Ponitz. So he utilized a 1 millimeter thick transparent pressure-formed sheet and a positive electrothermal press to truly manufacture the first transparent retainer. So that provided a practical solution for development of subsequent invisible orthodontic appliances. And in 1985, Dr. Sheridan invented the Raintree Essex appliance system. So that simulated the tooth arrangement on plaster models and processed transparent orthodontic appliances through thermoforming technology. But these appliances had low efficiency, and the precision of tooth movement was actually difficult to control. So the mass production of these appliances were quite challenging. So there was a limit with their widespread application in clinical orthodontics. But in 1997, this was the establishment of the first invisible orthodontic appliance by Align Technology, Kelsey Worth and Zia Chishti. So probably all of you know about this brand, Invisalign. So they started doing the first invisible orthodontic appliance, and they established Align Technology in Silicon Valley, where they developed clear aligners for clinical application. Then the birth of Smartee in 2024. So it's more than 20 years of dedicated research and innovation that collaborates with orthodontic experts worldwide to develop a unique clear aligner solutions. So now we have more than 131 million aligners that were produced with more than 99,000 doctors using Smartee and more than 1,063 patents in more than 57 countries worldwide. So we have perfected 1.9 million perfect smiles. So our product development are based on professionals' philosophy. We have Professor Gang Shen and his orthodontic team, our chief R&D scientist, to develop our Smartee GS solution. That is the one with mandibular repositioning technology. And we do have also a different team for our Smartee team, Professor Xiaobing Li, Professor Zhan Shi, and other professionals who contributed to our product development. Here are the milestones of Smartee since 2004 when it was founded. As you can see, we have developed our Smartee solutions up to S20 technology in 2023. And we have a new intelligent manufacturing base in Jiaxing and also in Madrid, Spain. So we have developed since 2004 up to the present. Let me share with you a video on how we have innovated to embrace the future. We started having the manual before we did the automated production. So that is more than 20 years of innovation while continuing to embrace the future for Smartee. So here are our institutional investors. And we had a Series D funding of more than 80 million US dollars with Chinese A shares that was filed, IPO filing on Shenzhen's stock exchanges in 2023. And here are our certificates with more than 1,063 patents. So here are our manufacturing bases. Manufacturing bases in Jiaxing plant, in Sichuan, and Madrid, Spain. We also have our aligner sheet production plant, fully automated aligner sheets production plant. So you may be wondering, how different is Smartee from the other aligners? Others may say, oh, Smartee is just like the other aligners. All of them are the same. It's made of plastic. But then let me highlight with you, what is the unique feature of Smartee that is different from the others? When it comes to stain resistance comparison, definitely Smartee is far more transparent with better color resistance. So this is an actual test that was immersed. The aligners were immersed in brewed coffee. So as you can see, the one on the left is Smartee, the other one is the other aligner, another aligner brand. After 24 hours of immersion, you can see that Smartee is clearer compared to the other brand. And after 48 hours of immersion, you will see Smartee is much more clearer. Now, if you're already using Smartee, you will be able to see the difference as well. And we are the only Disney licensed clear aligner brand globally. We are the only Disney IP authorized to use the product as a fantastic marketing tool for our clinic. And our mandibular advancement device is both for growing patient and adults. So others may have also mandibular advancement devices, but only for growing patients. But for Smartee, we both use it for growing patients and adults. And just recently, Professor Gang Shen was named one of the top 2% of the scientists globally because of his remarkable contribution to the orthodontic research. And he has more than 30 years of research in mandibular repositioning with more than 100,000 successful mandibular advancement cases for adults. And here are the samples of the GSKs with mandibular repositioning. This is using the SGTB or sagittal guided twin block appliance to treat the class 2 malocclusion 3 depths. So this is before and after, and the duration is 24 months without doing any extraction. So apart from that, we do have our unique Smartee software. So we do have our self-measurement, our oral health assessment report, our outcome pre-refinement evaluator. So I will be discussing those later. And we also have our unique Smartee solution. So this is the biomechanics on how we move the teeth, S1 up to S20. So let me discuss to you one by one what are these Smartee solutions. S1 is our classic attachment system. So what are our additional attachment system? So we include not only the bite pads, ovoid attachment, window attachment, vertical or rectangular attachment, or horizontal ones. We also have the intrusion attachment. So the intrusion, by the name itself, will help to intrude the anterior teeth to prevent the posterior teeth from extrusion. And the precision control is used to adjust the teeth angulation and to prepare the posterior teeth anchorage and for root control. So this intrusion attachment will help to level curve of speed. Our S2 invisible lip bumper. This is patented by Smartee. And this is placed usually on the labial side of the maxillary and mandibular, or most of the time is on the mandibular anterior teeth to prevent anterior proclination. So during the mesialization or sequential sequential distalization, we really need sufficient amount of anchorage. There are times wherein we are required to place TADs, but in the absence of TADs or as an alternative to TADs and intermaxillary elastics, we place this lip bumper in cases of molar distalization. And usually for mandibular advancement too, that requires also myofunctional training because there will be labial training exercises so that the pressure that will be produced by the lip muscle can be transmitted to the posterior teeth. So it can also help to prevent proclination while doing that sequential distalization. Now, this S3 intelligent traction is the normal traction system that we normally place the buttons on the tooth. We will usually prepare a cutout for the button, reserve a cutout for the button for you, and also leave a precision cut for you to hook on the elastic. So this elastics includes class 2, class 3, even cross elastics or triangular elastics. So that is our normal intelligent traction system. Our S4, intelligent power arm or TADS or mini screw, well, if ever we need to close a large extraction gap or a tooth extraction gap, we might need to use an intelligent power arm because this intelligent power arm being closer to the resistance center of the tooth movement will make those bodily movement of the canines more accurate and efficient once we use TADS with it too. So it can help to successfully close an extraction gap. S5 Intelligent Rotation Center, that's also patented by Smartee. So this will help to prevent bone fenestration or bone dehiscence or bone cracking. So as you can see here from stage 0 up to stage 28, there's risk on stage 0. We see the very thin alveolar bone. So if we make tooth movement, it might be difficult because there might be a risk of bone cracking or bone fenestration with it. But looking at the end result on stage 28, we can see that the risk is no longer there because there's no risk of bone cracking. We use AI algorithm to determine the rotation center and the angle for precise control of the tooth movement. So that is our S5. So you might be wondering how we control the force, the torque. So we use S5 with that. S6 is our classic tooth extraction protocol. So we actually provide more accurate tooth movement control in extraction cases. So we effectively avoid the roller coaster effect. Our S7 classic molar distalization protocol, this is our sequential distalization. So we are determining the staging method of sequential distalization in different amounts. So it can be used in conjunction with elastics. We can also will use a lip bumper with it or palatal devices to enhance anchorage. Apart from that, we have developed our S7 Plus. This is the simultaneous distalization technique for posterior segments. And this is assisted by bilateral mini screws or TADs or temporary anchorage devices. So this will enable to simultaneously distalize the first and second molars with redefining efficiency. So what are the benefits of using this S7 Plus? It's crafted to minimize anchorage loss. It can also prevent anterior labial tipping or reciprocal motions. It can reduce the number of interdental spaces to prevent food impaction and enhance comfort. It can also boost the treatment efficiency of molar distalization, and it can facilitate the simultaneous movement of multiple teeth to enhance clinical efficiency, and it can also shorten the treatment duration. So S1 up to S7 Plus, these are all included in our Smartee GE or the basic product of Smartee. Now we also have our S8 device for mandibular advancement. S8 is divided into two. We have the S8 SGTB and the S8 SGHB. So what is the SGTB? SGTB stands for sagittal guided twin block. SGHB stands for sagittal guided herps. So when do you use SGTB? Both of these S8 are used for class 2 malocclusion. Okay, the first one, SGTB, is for 3 depths, class 2 malocclusion, meaning to say that the patient has deep curve of spee, deep overbite, and excessive overjet. So everything in excess, we use SGTB for that. Now, SGHB, sagittal guided herps, this is how it looks like, is only for 1 depth, class 2 malocclusion, meaning to say it is only for excessive overjet, but mild overbite, and not mild overbite, but shallow overbite and shallow curve of spee. So that is suitable for resolving this class 2 malocclusion with only 1 depth. We also have the S8 SGHB plus mandibular deviation for mandibular deviation caused by condylar asymmetric resorption. So these are mostly seen in skeletally originated facial convexity cases. And this is how it looks like for S8 SGTB initial wearing. So we have this twin block, a clear version of a twin block. And this is an example of an S8 SGHB sagittal guided herbs. Initial wearing, and this is how it looks like. And our S9 is also the mandibular repositioning device with bite plane. So when do you use this S9? It is for patients with straight profile, class 1, but deep overbite. So we will be creating a vertical space for this deep overbite to stabilize not only the mandibular position, but also intrude the lower anterior teeth and level the curve of speech. So this is more secure and more efficient than the bite ramps that we place on individual chews. So you have the option to still use the bite ramps if you use our regular package or the Smartee GE to treat the deep overbite, but you can also choose, to use the mandibular repositioning with bite plane to make it more efficient and more stable. So we have two types for this. We have the anatomical and the non-anatomical bite plane. Now, our S10 mandibular repositioning device, that is with occlusal split. So when do you use our S10? This is suitable for mandibular deviation and for facial retrognatism cases or for functional deviation. So we need to disclude the teeth having that occlusal splint so we can do the lateral shift to correct the mandibular deviation and for us to correct the facial retrognatism or class 3 cases. Now, S10 Plus was created. It's the same with the occlusal split. So the difference between S10 and S10 Plus is that S10 will be having that extension either on the buccal side or the lingual side to strengthen the horizontal retention. There might be no lateral restrictions that may contribute to the lack of efficiency for just a normal occlusal split. But having this extension enhances the horizontal retention, especially for the deviation. It stabilizes the occlusion during mastication or chewing to prevent further lateral deviation. So it will promote the establishment of the proper cusp fossa interdigitation to improve occlusal stability. So especially for those cases with facial convexity or condylar resorption or mandibular deviation, or for those with condylar hyperplasia or mandibular deviation. Now, our S11 palatal devices come in 3. It consists of first a clear arch expander that helps to expand the arch. How does it does arch expansion? By the way, this is only dentoalveolar arch expansion. It is 5 millimeters wider than the actual arch width that creates that expansion effect. And as for the clear Nance, this will assist in the distalization of the posterior teeth. So it will strengthen the anchorage while doing that distalization. As for the clear TPA, once the posterior teeth have been in place, it will help to stabilize that position, thereby retracting the anterior teeth. So these are the actions of these palatal devices. Now we do have our S15 integrated traction device. Remember, I discussed earlier the S3 traction device, the normal traction system. But we do have these integrated traction devices that are integrated into the aligner. So you don't have to use the button to place it on the tooth, but this is part of the aligner itself. So it's not easy to slip because it's part of the aligner. We have the Smartee hook and the Smartee button. Well, this Smartee hook is actually, it utilizes it is formed integrated thermoforming process suitable for common elastic methods. For example, if you want to do a class 1 or a class 2 or a vertical elastic, it's a one-directional force. As for the Smartee button, this is multi-directional forces, meaning to say we can do class 1, class 2, class 3 elastics because it is aerospace riveting process. And it can be angulated or adjusted according to the traction direction. So this can withstand a maximum traction force of up to 3,000 grams, making it more efficient with any kind of elastics or when you do traction. It is strong enough to handle this kind of force when you do your invisible forwarding traction device. S16 is for growing patients. So it's a combination of the face mask, our S15 Smartee button. Sorry, this is Smartee button, not hook. Smartee button or the one with palatal devices, because we may be able to utilize all of those in promoting the growth of the underdeveloped maxilla for facial retrognatism cases. So we also can put in the occlusal splint. Our S17 is the active mandibular positioning retainer. So we use this special retainer after we do our mandibular repositioning cases. We highly recommend to use this product, not just a regular retainer, for making it having less chance of relapse. You know what I mean? It prevents high chance of relapse because of mandibular displacement once we do our mandibular repositioning. So we have three types for that. We have the SGHB type, or the sagittal guided herbs type, the one with a wing. We have the anatomical bite plane type, and we also have the combination of both, the anatomical bite plane and the one with the HB type, combination of both. Now, we haven't launched this yet globally. S18 clear appliance for perioperative orthodontic treatment, but we would like you to know that we'll be having that soon. So what is this solution? It is for orthodontic surgery. Preparation for orthodontic surgery, pre and post-operative. It's an invisible dental guide plate and post-operative immediate aligners. Now, our S19 clear appliance for relieving the obstructive sleep apnea syndrome, we already have launched our SA. So later I'll be discussing our SA product. Soon we'll also be coming up with our S20 early correction of facial retrognatism face treatment for the whole duration comprehensive treatment plan. So why did we come up with our S20? Remember, I told you that S10 can also be used to treat facial retrognatism cases. For growing patients, we found out that the jaw, there's no stopping the jaw growth. So it's very important for us to first do a diagnostic classification of this facial retrognatism and help come up with a prediction of jaw growth and analysis of the mandibular morphology early stage and the application of our GS technology, including our S10, S11, S16, those products to really treat the facial retrognatism with a more success rate. So now that you have understood our S1 up to S20 Smartee solutions on how we move the teeth, let us compare what we have with the other aligner companies. So if you will see here, the one with the red highlights, check with the red highlights, are exclusive, meaning to say those are patented by Smartee. So the one with a check mark, though others may have them, they have a similar one. But we do have a lot of exclusivity when it comes to the Smartee solutions, such as the S2 invisible lip bumper, our S5 intelligent rotation center that is patented by Smartee, our simultaneous molar distalization protocol S7 Plus that is exclusive with us, and our device for mandibular advancement such as the S8, S9, and all our other solutions up to S20. Apart from those solutions for adult patients, we also have our unique solutions for our growing patients, K1 up to K5. These are specifically for patients aged 3 up to 10 years old. We have the K1 optimized attachment for children. We have the tongue protrusion or tongue crib, which later on I will be discussing in detail. We have our myfunctional trainers, because we also want to make sure that their poor habits are addressed as well. So apart from our adult product series, we have our Smartee Kinder and Teen. Smartee Kinder is for ages 3 to 10. Smartee Teen is for ages 3 to 16. So our solutions for teen package, as you can see, also have mandibular repositioning devices. So other aligner brands may have a similar device for mandibular advancement for growing patients, but ours is more unique. So later you will see why it's unique, because I will be highlighting our mandibular repositioning devices. Our S11 palatal devices are for dentoalveolar, but for the other brand, it actually can do skeletal expansion. And it's not part of the aligner itself, but our palatal device is integrated into our aligners. And we have our unique templates. So you may wonder why we have a lot of templates in our package, because we want you to have a choice between having the standard attachment template and a softer attachment template. Others would want a softer one for easier removal of the template once they place the attachment on, but others would still prefer the standard one or the hard one. And we also provide this acid etching attachment template. So how good is it to have this acid etching attachment template? It saves time for you because those have holes in it. And those holes are the ones that you will be placing the attachment, the etchant on. So it will not scatter on the entire teeth, making it easier for you to remove the flashes on your composite once you put on an excess composite attachments. So this is really useful. And of course, our Smartee system. We have a lot of digital tools that you can use for free once you have the Smartee account. So these are the oral health assessment report, which is what I like. This is something new with Smartee. We have our live 3D and live update to make it easier for you to approve the case. So you don't need to wait for the animation, or sometimes if you want to make modification in your animation, it's easier for you to do the 3D controls yourself and just approve the case in a matter of 10 minutes. We have the outcome evaluator. So if you will be sending for refinement, you will see the movement completion ratio if you use this tool. We have the Smartee Doctor app. We have, you can actually download this in your mobile phone. iFast is the before and after animation, not animation, but it is before and after result once you submit only the STL file. We have the Ceph measurement for precise diagnosis of the Ceph analysis and the root visualization in your animation. So the turnaround time for our animation can be within 30 minutes from submission to approved animation. For simple cases, you can make use of the live 3D or AI 3D animation. But of course, for more complex cases, you may still need to submit it and wait for the animation release in 3 to 5 or 3 to 4 days. But you can modify it using the live update. For example, if you want to do some minor modification in your animation, you don't have to wait for 3 to 4 days for them to do the animation again. You just have to use the 3D controls and make adjustment, minor adjustment, click live update, and generate a new animation for you to approve the case right away. So we have this 3D controls or 3D animation modification, so you are in control of the teeth movement. So what is iFast? For case communication with your patient, if ever you don't have yet the photos of your patient, you don't have yet the x-rays, but you are discussing Smartee with them, and they want to somehow have an idea how it will look like at the end of the treatment, then you can just scan the teeth and submit the upper and lower STL file, and in a matter of 5 minutes, you'll be able to generate the before and after result. But no animation staging yet, because this is just the iFast AI outcome simulation. Now, for all your animation, you will be able to visualize the root. So there will be root visualization in the absence of CBCT. But then if you want to see the actual roots using the CBCT, you may upload a CBCT in DICOM format so we can use that in your 3D animation. Now, we do have the Ceph radiographic measurement. So in a matter of minutes, you'll be able to generate this cephalometric measurement and even the bone age measurement. So you can also see the airway analysis using this tool, Ceph measurement tool. You can also make a comparison using the photo and also do a superimposition. You can actually upload 1 up to 5 Ceph x-rays. And then we have the outcome pre-refinement evaluator tool, digital tool. So if you will be sending for refinement, you will be able to see the movement completion ratio. So just click on the chromat difference, and then you will see here, for example, if you ended um, with the refinement with the patient 22 sets, and then you'll be able to see the movement completion ratio. So how helpful will this be? It's good for communication with the patient because you'll be able to see here which teeth did not track clinically to the movement plan, which are the teeth that moved significantly, and which are the teeth that did not move significantly. So you'll be able to also make careful clinical management. And the oral health assessment report, if you don't have the scan of your patient yet, but you do have the photos and the x-rays of your patient, submit it in this digital tool platform. And in a matter of minutes, it will generate the oral health score of your patient, their problem summary, um, oral health score, the photo analysis based on the photos that you have submitted. So you'll be able to see here the dental disease screening, if there's deviation of the midline, if there's overbite, what is the molar occlusal relationship, and the canine occlusal relationship. What is the amount of overjet or overbite? So you will be able to see in here for good communication with your patient. You will also be seeing here the panoramic radiographic analysis. So the problem teeth, you will see its color explanation. We have the airway analysis based only on the LATSEF X-ray. So you will see here the abnormal prompts. If there is a short upper airway length or the pharyngeal area is small, and the LATSEF analysis abnormal prompts, you will be able to see in this page. And the bone age analysis, both the quantitative analysis and the qualitative. So here you will see if the patient's cervical vertebra is fully developed, if it's CS6, CS5, or the completion phase already, deceleration phase. The frontal smiling analysis or the side profile analysis, if the buccal space is medium gap or normal, nasolabial angle, smiling simulation, visual treatment objective, and the Smartee Doctor app on your mobile phone. So even if you're not in your clinic and you want to view the case of your patient, you can use your Smartee Doctor app. So here are just 5 things that Smartee can do to ensure a predictable treatment plan for you. So we have more than 400 plus smile designers, and we do have quality control as well. So each 3D animation or setup is required to be approved by our smile designing supervisor before releasing to the doctors. And we also consult with our Smartee Smile PhDs and professors, think tank, PhDs and professors. And our advanced medical design solution is more than 20 years of experience with data-driven predictive treatment plan, because we've already had more than 1.9 million successful cases. And Smartee is high with academic events, because for us, education is important for you to be able to make a good treatment outcome. So we support you with education via these dental conferences. So these are some of the highlights when S8 and S9 was launched, and Smartee and Professor Shengang and his orthodontic team would normally hold academic events, not only in China, but also in different countries that we support. Okay, so now you've known that Smartee can treat almost all cases and all patient profiles. So we just have to determine what is the case of our patient. Do we need to just close the spaces, or do we need to also correct the overjet, posterior teeth? That's why we have diverse product options to choose from. I know some doctors might think that why Smartee have a lot of products? It's quite confusing. But after, explaining everything to you, you'll appreciate it more because you will be able to determine what separates this product from the other, and it is customized to treat specific cases for you. Okay, so we have 5 product options to choose from. The first product is GE. Why the name GE? It's general. That is the basic product of Smartee. So that is similar to the other products, other brands that can do mild up to complex cases. But we also have the Smartee Alpha that has a daytime and nighttime aligner per stage. So later I'll discuss them in detail. And we have the GS, the one with mandibular repositioning devices. We have the teen and the kinder for growing patients. As you can see, we have unique medical team to back us up with more than 500 plus smile designers now that are highly trained with degree in stomatology. And we also have a unique R&D team for our Smartee GS because those are for highly complex cases. That's why it has to be headed by Professor Gang Shen and his orthodontic team. And we also have a separate R&D team for our kindergarten team for ages 3 up to 16 years old. Now, because we have 5 product options, that's why we have separated them into adults and for growing patients. So let us now go through our adult product series. Smartee GE are subcategorized into 4. So you have the option to choose the regular packaging for them or the Disney product option. This is just for the case and the box. But of course, the aligner itself doesn't contain Disney in it, But our subcategories are 4. First is mini. So it's up to 10 sets of aligners. That is to treat for ultra mild cases. Sometimes for aesthetic alignment only, it comes with 1 free refinement within 1 year, and we also include 1 set of free retainer at the end of the treatment. So earlier, you somehow know about the Smartee solutions. S1 up to S7 and S15 Smartee hook are all included in all our Smartee GE series. But if ever you want the palatal devices or the Smartee button or the tongue protrusion or tongue crib in our GE series, then that will be an extra charge. And our Smartee GE Lite is for mild cases. So mild cases samples are for arch expansion, or if you want to correct some minor rotation or close a space. This is up to 25 sets of aligners. We include 2 free refinements within 3 years for this one, and we also include 1 set of free retainer at the end of the treatment. I'm going to show you an example of a Smartee Lite case. So this case is a midline deviation after fixed orthodontic treatment, meaning to say that there is off midline, not centered midline, that we need to correct. So total treatment time for this is 15 months with 20 sets. So as you can see, there was no refinement done. It was corrected. Another case is a class 3 with anterior partial crossbite. So initially it was 25 sets for this with 2 refinements, 8 and 3 sets. Total treatment time was 19 months to have this result. Now, our third subcategory for the GE is Express. So this is for moderate cases. So it's up to 40 sets of aligners, and it includes 3 refinements. Remember earlier I told you there were simple cases, there were moderate cases. Simple cases are highly predictable. That's why our refinement is only 1 for both light and mini. But moderate cases are moderately predictable. That's why for Express, this is for moderate cases, we offer 3 refinements free within 3 years. So this comes with 2 sets of free retainers at the end of the treatment, and examples of which cases are overbite, overjet, crowding or spacing, crossbite, distalization. For cases that requires distalization, you choose Express, not the light one. And here are some of the example cases. Posterior crossbite, treated in 27 months. 24 sets initially, and 3 refinements were used to achieve this treatment outcome. But of course, since we have our GS already, if ever you want to shorten the treatment time, we have our other product options too. But this is just for the regular package or the Smartee GE. You can still treat it, but the total treatment time might be longer. So for another sample case for the moderate one or Express, non-extraction treatment of low angle crowding through arch expansion. So the total treatment time for this is 13 months with 27 sets initially to achieve this treatment outcome. Now, the treatment outcome will vary. So it's not standard, okay? So there's a lot of factor involved with the treatment outcome. One of which is the patient compliance. So that will really contribute to the amount of months or years that they will finish or end their cases. Now, another example of our express is this open bite case, anterior open bite, 26 sets initially with one free refinement, and total treatment time to finish this case is 19 months. And the last in the series of GE is the Infinity. So this is unlimited sets of aligners with unlimited refinements within 6 years. Remember, I mentioned that for complex cases, those are less predictable. That's why we are offering unlimited refinements for you. And it comes with 2 sets of free retainers, ideal for moderate to severe cases. These are for moderate to severe class 2 or class 3 malocclusion with teeth extraction or open bite, molar uprighting, and these are some of the sample cases for the Infinity. This is a high ankle mandibular deviation with premolar extraction before and after the treatment. Total treatment time was 22 months. Initially, it was 45 sets with one refinement that are 40 sets to finish this case. And we have this moderate crowding accompanied with deep overbite and excessive overjet. Total treatment time for this was 34 months. And 30 initially with 3 refinements after. Now we go to our second product series, which is Smartee Alpha. Why did we come up with the nighttime and daytime aligners? Will it be confusing for the patient? Why do we need 2 per set or per stage? Now, recent studies have shown that there is a correlation between the growth and remodeling of the condyle and with the movement of the teeth in the periodontal ligament and even with the pain associated with orthodontic treatment. That's why we have designed a specialized treatment plan based on the human circadian rhythm using our AI intelligent nighttime efficiency compensation protocol. So our bodies react differently. When we are awake, there's more activity, then our bodies react differently too. But when we are at rest or when we are sleeping, our bodies are also at rest. That's why we need to provide efficiency when the patient is at rest or if the patient is sleeping. So we have this daytime aligner to speed up the correction process. So this has strong encapsulation, super resilient with good tear resistance. Whereas the nighttime aligner, not only does it provide efficiency compensation because it has a more stable, more continuous, more controlled teeth movement at nighttime. It provides uniform force with excellent controllability to perform difficult teeth movement such as root control, root uprighting, or derotation. That's quite difficult to achieve when the patient is at rest. So just to show you this table, the treatment plan table, how we compensate for this nighttime efficiency. Now, looking at the expression of movement, 65% for clear aligners here. Daytime aligners, take for instance that the patient is just using one aligner, daytime and nighttime use. Stage 1, 2 degrees, stage 2, 4 degrees. This is not the exact amount of movement, okay? This is just a representation. 6 degrees, and as you increase on the staging, you also increase on the amount of movement. Now, if you will multiply the expression of movement for clear aligners, 65%, with 2-degree movement, you are getting only 1.3-degree movement to achieve this 2-degree for that stage 1. Thereby having a 0.7-degree at rest because there's no movement when the patient is sleeping, right? But when you add movement at nighttime, making it 3 degrees, adding 1-degree movement per aligner. And when you multiply that with the expression of movement 65%, you are getting a 1.95-degree, making only a 0.05-degree at rest. So meaning to say 1.95 to achieve a 2-degree movement on stage 1, that is more precise movement. So it's like doing overcorrection or efficiency compensation. Our golden ratio is that for daytime aligner, patient has to wear it 14 hours and at nighttime 8 hours. So apart from that technology, we also are including our S11 and S15 Smartee traction system. So we have the palatal devices that are included in the package. So if you'll be using GE, this will be an add-on. But if you'll be choosing Alpha, so this is already included in the package. We have these 3 forms of palatal devices. We have the clear arch expander, we have the clear NANS, and the clear TPA. And we also include the integrated traction device, our Smartee hook and the Smartee button, which is more targeted to your traction force. So choosing Smartee Alpha compared to GE saves time for your patient. So it minimizes the treatment time. It's more efficient as well because the patient is using two aligners in one stage. So if ever the patient loses one set, you don't have to order an additional set. Just use the other set that the patient has before you go to the next stage. So showing you an example of a Smartee Alpha case before and after the treatment. These are the facial photos. Here are the intraoral photos and the comparison of the radiograph. So Smartee Alpha, similar to Infinity, also have unlimited sets of aligners with unlimited refinements within 6 years. And it also includes 2 sets of free retainers. So the daytime aligners provides a comfortable treatment experience, whereas the nighttime aligners can provide a powerful force for difficult teeth movement. Now let us go to the Smartee GS. Smartee GS is the one with mandibular advancement or mandibular repositioning devices. For class 2 malocclusion, you can still use the Smartee GE, the Smartee Alpha, but if you want to improve on the facial profile of your patient, then I might as well recommend to you the GS because this will help to prevent tooth extraction or tooth surgery. And you can get the dream facial profile for your patient as well. So let me highlight to you what are the features of our Smartee GS. Sharing with you some of the benefits of doing mandibular repositioning or mandibular advancement. It can actually open the respiratory tract. It can improve or cure the gummy smile of your patient, relieve or treat condylar joint discomfort. You are carrying out both orthodontic and orthopedic simultaneously because we're doing a 2-stage technique with it. First phase or first stage will be the orthopedic. You are stabilizing the jaw position. And then the second phase or the second stage will be the orthodontic phase, wherein you will move the teeth once the jaw position are established. So it can reduce tooth extraction or avoid tooth extraction and can help minimize or avoid high amount of distalization. So it can also minimize the treatment plan for your patient. So what are the features of our Smartee GS? We do have these mandibular advancement devices. So we have the S8. Again, let's go back to S8. S8 is to treat skeletal class 2 malocclusion cases. SGTB and SGHB is for the S8 mandibular advancement. Again, when do you use SGTB or sagittal guided twin block? So it helps resolve class 2 malocclusion with deep overbite, large overjet, excessive curve of speed, everything in excess. So this is without extraction. We're able to improve the facial profile of our patient after. And then the class 2 malocclusion with only one depth or excessive overjet, but flat curve of speed or normal overbite, then we use the SGHB for that or the sagittal guided herbs. Now, S9 bite plane, again, is for a straight profile patient, but with deep overbite. So instead of using the bite ramps, we are placing this bite plane. So it helps to stabilize the mandibular position. It can create this vertical space for deep overbite and intrude the lower anterior teeth to level curve of speed. Now, S10 occlusal splint works in 2 ways: to treat mandibular deviation or for facial retrognatism or class 3 cases. We have S11 palatal devices. These are all included in the GS series. We have these 3 forms: clear arch expander, clear NANS, and clear TEA. And we have the S15 that's also part of the GS system, the hook and the button. S17 is part of the GS but not free. So this is a separate case, meaning to say, if ever you want to avail only of this active mandibular positioning retainer, maybe for your braces patient, you can avail that using the GS series. Now, if ever you have a patient that requires mandibular repositioning, for example, you see a patient exhibiting those 3 depths, malocclusion, or even 1 depth, we would want you to do the correct wax bite registration for that. So we have to Look at the classification system by Professor Gang Shen, the one that he made, because these are all based on research and development. So we classify that into fundamental skeletal. For one depth malocclusion, class 2 malocclusion, one depth meaning to say only excessive overjet, but shallow overbite and shallow curve of spee, we classify that as fundamental skeletal. And for the one with 3 depths malocclusion, we classify them into 3. So if you will see, the common denominator in them is mandibular retrusion. So the patient is exhibiting mandibular retrusion, but dentoalveolar in origin. The first one, dentoalveolar, meaning to say that the teeth are protruding. Remember, these are 3 depths: deep overbite, excessive overjet, deep curve of spee. But then the first one, first category, dentoalveolar, only the teeth are protruding. There is no prominent bone. So we classify that as dentoalveolar. But for skeletal one, meaning to say that there's prominent bone, the teeth may not be protruding. A skeletal two, there is also prominent bone, but the teeth are retrusive. So why is it important for us to do a classification? Because there will be a different wax bite registration procedure that you have to follow before we are able to accept your case for mandibular repositioning. So we are quite strict in accepting because we want you to have a successful result. Otherwise, we will not be able to have this remodeling of the condyle, especially for adults, if we don't follow this protocol. So for S8, SGTB or sagittal guided twin block, let us go back to it. We have 3 classification. Again, dentoalveolar by the name itself, teeth are protruding but not prominent bone. Skeletal 1 and 2 are prominent bone. So if ever that you will be moving the jaw forward, you have to make sure to observe this 3-dimensional positioning: sagittal, vertical, and transverse. Okay, S8SGTB, for sagittal, 2 millimeters overjet remains for the dentoalveolar. I think I can show you a more clear photo here. Because when we submit for a GS case, we have to submit a before and after mandibular repositioning STL files. Okay, because we have to take the original bite and also the one with the wax on, the one that we have repositioned or moved forward. So in getting the scan, you have to scan first the upper and lower. And then you have to determine these 3 dimensions. You practice your patient to move their jaw forward slowly. Now, the first one with upper incisal procline 2 millimeter overjet remains is for dentoalveolar. Mandibular retrusion, dentoalveolar, you have to maintain a 2 millimeters overjet because there's no bony protrusion in it. Now, this other two, the one in the middle, edge-to-edge bite, for those prominent bones, skeletal 1 classification. And for the third one, because the teeth are retroclined, you have to compensate for that, doing a 2 millimeters cross bite for sagittal direction. So apart from the sagittal guide, you also need to check on the vertical height. Vertical height distance should be at least 5 millimeters. So what if you did, for example, your classification is skeletal 1, and then you have to do a sagittal direction of edge-to-edge bite. But then the vertical height is not sufficient. Then you have to raise the anterior bite by 1 to 2 millimeters to achieve a 5 millimeters posterior open bite. That's how you do it. And for the third consideration is the transverse. Always coordinate the facial midline with the chin point. The chin point should always prevail. So these 3 methods, or what to observe, when you do your advancement, are very important. So once you're able to practice your patient how to do that, how to advance the jaw forward, minding those 3 directions, then you can already prepare now your pink wax. So what I do is that I cut the pink wax, the whole pink wax in 2. I fold it. I use only half of it. And then I heat that in hot water, roll it once it's soft, and then fold it once. And then once you fold it, you'll be creating only this small size to cover 3 to 3 or 4 to 4 areas of the teeth only. So once you're able to heat up that wax, put that behind the upper anterior teeth and slowly guide the jaw forward. Again, minding those three directions: sagittal, transverse, and vertical. Make sure that the frontal area is cleared and the buccal segment without wax so that you can scan the teeth successfully. So don't let it cover the entire teeth, okay? And because you also need to take photos. So we need to take the original photo with a normal bite on, and you also need to take photo with a wax on or with a reposition bite, okay? And then you can scan once the wax is there. And this is how it will look like. It will not show the pink wax. Okay. So these are the summarized 4 steps of wax recording. So this is an example of a finished SGTB case, before and after, initial and final result, without doing any extraction. And another case, SGHB, before and after. So for GS, it's unlimited sets of aligners with unlimited refinements within 6 years. And we provide 2 regular free retainers. But again, like what I've mentioned, it's highly advisable to use S17 because we've tried and tested that one. And there are clinical results after 2 years, 4 years that did not change. There is no relapse after 2 or 4 years. So this can help, the Smartee GS can help to improve the facial profile and correct the teeth simultaneously using our mandibular repositioning devices. Now we go to our Smartee solution for early orthodontic treatment. So these are for growing
Later, I'm
patients.
going to throw away. After dinner.
Can mute your mic, please, so we can continue? Thank you so much. Okay, so let's go back to our Smartee products for growing patients. So we have different packaging, Disney packaging for them. We have Iron Man, we have Frozen, we have the Stitch, and these are for ages. Smartee Kinder is for ages 3 to 10. Smartee Teen is for ages 3 to 16. Normally, we see this type of cases for our growing patients. But for teenagers up to 16, we can already see facial prognatism in them. So there's a lot of factors that we need to consider with the malocclusion for growing patients. Because according to Dr. Profit, malocclusion is not a disease, but it is defined as a developmental variation of their normal occlusion. What does it mean? There are a lot of interferences during their early tooth development. So there's a lot of factors involved here, like genetic factors that we can't do about. I mean, genetic is genetics, but there are environmental factors that we need to consider, such as the functional factors that we can correct. These functional factors has something to do with how they breathe, how they chew, incorrect swallowing. Those interferences needs to be addressed. That's why our treatment strategy for our Smartee Kinder is prevention and interception of these interferences. So our treatment strategy for primary dentition is for 3 to 6 years old, early mixed 6 to 8 years old, and middle mixed dentition 8 to 10 years old. 2 years management, meaning to say that you can have unlimited refinements and aligners within 2 years. So what are these interferences that we see during early tooth development? Occlusal interferences, the teeth, right? We need not only the teeth that we need to consider, but we also need to check how they swallow, how they use their tongue, how their tongue is not raising up to the palate. So the myofunctional interferences are also one of the considerations when we check our patients. Their poor habits, we have to also address their poor habits, because even though we align their teeth, if their habits are there, it will defeat the purpose of us correcting it. That's why Smartee came up having not only clear aligners that has these special features, tongue protrusion, tongue crib, with a special trimming protocol that extends the margins for proper retention or for better retention. So, what are these aligner features and what does it do? Our tongue protrusion is set on the upper aligner to guide the tongue to its correct position. So there is the spherical protrusion behind the upper anterior teeth. Remember, our tongue should always sit on top of the palate to have good airway or breathing for patients. So it will be training the tongue to sit on top of the palate because there's a spherical protrusion in there. Now, the tongue crib is set on the lower teeth to help correct the poor tongue habits such as tongue thrusting, tooth licking. So these should be, when you submit STL file, it should cover, the data of the complete hard palate, and for the lower, it should contain the data of the hard palate 3 to 3 or 4 to 4. And we have this special aligner trimming protocol. So you can choose between having this conventional trimming only or the featured trimming for stronger retention, extends on the posterior area. But when you request for it, make sure that your scan can cover that mucosal area too. Wearing time for these patients is 20 to 22 hours per day as well. So like what I've mentioned, our treatment strategy for Smartee Kinder is for prevention and interception of the interferences. That's why apart from the aligners, we also provide these functional trainers, except for the Joy Joy. Joy Joy is an optional device. So what is Joy Joy? It is a specialized treatment used during mixed dentition period. So it will help to improve the arch form, coordinate the jaw relationship, the upper and lower jaw relationship. It may guide tooth eruption. For example, if your patients, the teeth are too small or may have not erupted, the important teeth have not erupted yet. So we may need to use this Joy Joy first to help with or guide the tooth eruption. We can already improve the dental and facial development, so we can use Joy Joy. This is how it looks like with the patient, by the way.
Joy Joy, to improve arch form, guide interruption, coordinate jaw, and occlusal relationships for children at mixed dentition period.
So we have different sizes for that. We have 4 sizes to choose from. So we also have this clinical guide, how to select the Joy Joy size. So for arch width, we can also help to choose for you, depending on the data that you have submitted to us. Now, these 2 other multifunctional trainers come free, the Bitey Bitey and the Smiley Smiley. So what does Bitey Bitey do? It performs 3 movements, 3 muscle training exercises: labial muscle training, tongue muscle training, and masseter muscle training. Because kids, growing patients, kids specifically 3 to 10 years old, have poor muscles because they chew on soft food. That's why we need to strengthen their masseter muscle. So we make this movement 20 times per set and 3 to 5 sets per day. So how does it work? Let me show you a video.
Bitey Bitey, to enhance strength of soft tissues including labial muscle, tongue muscle, and masseter muscle.
So our Smiley Smiley is to help with lip seal because we don't want our patients to be breathing from their mouth, right? Through their mouth. So it will prevent habits such as mouth breathing, lip biting, or even finger sucking. So this exercise, there's some hook in there that you need to pull 20 or 30 times per set and 3 to 5 sets per day. So you have to put it in between the teeth and lips, close the lips tightly, and pull it out quickly by hand or with external force. So this is how it looks like.
Smiley Smiley, to help correct poor habits such as mouth breathing, lip biting, and finger sucking, etc.
Now, our Smartee Teen, that is for ages 3 up to 16 years old. So the number of years is extended up to 16 because our treatment strategy for Smartee Teen is different. It does not only do prevention and interception of the interferences, we also do guidance and correction because we can already see the facial prognatism in them. That's why apart from these features, similar to the kinder, we also are incorporating the mandibular repositioning solution. and even the Smartee button and Smartee hook.
With specially designed clear devices such as Smartee's Invisible Advancement Device, Invisible Bite Plane, Invisible Posterior Occlusal Splint, Invisible Forwarding Facial Mask, and Palate Enhancement Device. With specially designed clear...
Okay, so again, let me highlight with you. Smartee Teen also comes with mandibular repositioning devices. We have the S8 for class 2 malocclusion. We have S9 bite plane for straight profile patient but deep overbite. We have the S10 occlusal splint for mandibular deviation and also for retrognatism, facial retrognatism cases. But the palatal device in teen is not free. This is an optional device. So if ever you see in the animation a palatal device for your Smartee Teen case, please take note that there's an extra charge for that. S15 Smartee integrated traction device come free in the package, but the S16 also is an optional device. This is the invisible forwarding traction device. We will be including the face mask, Smartee button, palatal devices, and the Bitey and Smiley. My functional trainers come free except for Joy. That's also optional device. For Smartee Kinder, we have unlimited sets of aligners within 2 years and also unlimited refinements. It includes 2 sets of free retainers at the end of the treatment. So our solution is K1 up to K5. The teen comes also with unlimited sets of aligners and refinements within 5 years, and it comes with 2 sets of free retainers within at the end of the treatment. But with teen, you can pause the treatment 2 times before the age of 60. So for example, you started the patient 7 years old using teen, you're finished with the patient after 1 year, then you can pause the treatment, then you can resume the treatment before the age of 60. Now, last on my slides is our SA and SA+. So this is our treatment for primary snoring. So SA is just to treat for OSAS or primary snoring, but SA+ is with teeth correction. So introducing our Smartee Sleep Aligners. So this is how it looks like. Is snoring loudly more than just noisy breathing? So this frequent snoring may be a signal for unobstructive sleep apnea syndrome that may affect both your sleep quality and overall health. So what is obstructive sleep apnea hypopnea syndrome? So it's a common sleep-related breathing disorder caused by narrowing or collapse of the upper airway during sleep. So initial symptom will be snoring. So there may be airflow that's through a narrowed airway that causes this vibration of the pharyngeal soft tissue. And of course, there are systemic health risks in it. The condition not only severely affects the sleep quality and quality of life, but can also trigger long-term risks, such as cardiovascular diseases. So how you determine if your patient have these OSA symptoms? Sometimes they will tell you, doctor, I have a morning headache, I have excessive daytime sleepiness or poor concentration, irritability. So these are all OSA symptoms or loud snoring or gasping for air. And based on the studies, according to the criteria of the American Academy of Sleep Medicine, it is estimated that in 2024, that was almost 2 years ago, the global number of OSA patients will rise. So we can see that now. There's a trend with the rise of OSA's patient. So what are the common treatment methods that we use for OSAS? CPAP. I'm sure a lot of you know about CPAP or continuous positive airway pressure. There's a surgical treatment. There's a traditional oral appliances. And there's also universal silicone or anti-snoring devices. So CPAP, what is the advantage of CPAP? So there's nasal dryness, air leakage, and difficult to wear. Sometimes patients don't really use that because of poor compliance. About 50% only use them for a long-term period. Surgical treatment, there's high trauma and long recovery period. And sometimes patients may still need to use CPAP after surgery. Now, for traditional oral appliances, these are bulky material that occupies the tongue space. Remember, tongue should be free of space so that it can raise on top of the palate. So it may cause speech restriction and difficulty in drinking during use. Universal silicone, by the name itself, universal, it's not personalized design. So it has poor retention and can easily fall off during sleep. So there are studies also by the Journal of Clinical Sleep Medicine that establishing the mandibular advancement device's efficacy by comparison to a placebo or inactive appliance. So in order for you to submit a case for sleep aligners, it's important for you to also have your patient checked for the AHI or a measurement using the apnea-hypopnea index. If it's mild to moderate, then you can use our sleep aligners. But if it's severe, then I don't think sleep aligners will help with your patient. Now, our conclusion here is that our market needs a simple, a comfortable, and effective alternative product apart from those products that I've mentioned. That's why we came up with our Smartee SA for primary snoring or OSAS and Smartee SA with teeth correction. So what are the difference between these two? Our Smartee SA is to treat only the sleep apnea. For those intolerant to CPAP treatment or unable to undergo surgery, this product can be used as a supplementary or alternative solution. Now, our SA Plus is to treat OSAS and mild anterior malocclusion with minor orthodontic correction. So there will be two aligners that the patient will be using. During the day, the appliance is used for teeth correction, and at nighttime, that will be the sleep aligner. It helps to maintain airway patency. Now, there will be titration first. The phase 1, we will provide you with the 5 sets. So the first stage is determined by the doctor. So some doctors who are experienced with mandibular advancement can determine the initial position, or for those who are not trained, can do the normal position first for stage 1. And then for stage 2 to 5, we will do digital advancement with it. So once we send an animation with the phase 1, you will approve it, and we will be sending you the first 5 sets. So what do you do with these 5 sets? You have to let the patient wear it for about 5 to 7 days each. And from there, you have to determine which of these 5 stages are more suitable for your patient or more comfortable. Then, for example, you choose that set. For example, it's 3. Then you have to click that, and we will be sending 12 sets for that stage. So this 12 sets one set can last about 1 to 3 months, depending on your patient. But after the 12 sets are gone, then you can order additional sleep aligner package. We will be, SA Plus, similar titration for phase 1, will be determining 5 stages. And then once you choose the correct stage, then we'll be sending the phase 2 daytime and nighttime. The total staging is 25 stages. And we only correct 3 to 3 teeth movement. So these nighttime aligners are based on the daytime teeth movement. So this is the sleep aligners with the anti-snoring device. And we will be sending 12 sets for it, for the nighttime. So what is the working mechanism of our Smartee SA? This is before wearing and after wearing. So our innovative design uses a dual splint locking structure through digital modeling. And for airway improvement, because it advances the mandible to optimize the 3-dimensional structure of the upper airways to enhance the breathing space. So there is vibration control because we are able to stabilize the position of the mandible to reduce the soft tissue vibration and minimize snoring. So it's patient-friendly, it's high treatment acceptance because it's more compact and more comfortable design. For clinical value, it's non-invasive solution. So here are the comparison of our sleep aligners with the conventional anti-snoring devices. Mandibular positioning, we don't manually adjust it compared to the conventional one. It's digitally customized, so it's free of patient's operation. We don't ask the patient to determine the correct position. Now, the impact on TMJ, because it's dual splint design, it's evenly distributed locking force for mandibular advancement. So it reduces the stress on the TMJ. As for the conventional anti-snoring devices, it's non-uniform bilateral adjustment. You may adjust left and right, it may increase the risk of uneven TMJ loading. For the wearing experience, a liner sheet material that we use is ultra thin, up to 1 millimeters, non-invasive. But for the conventional one, it's probably made of acrylic with metal screws. It's bulky. And for hygiene and maintenance, because our Smartee Sleep aligners comes in 12 sets, you replace it monthly. It's less risk for plaque accumulation or oral infection, easy to clean. For a conventional anti-snoring, it's yearly wearing. It can have this debris trapment. But of course, there may be contraindications or some factors that we need to consider in choosing this for a patient. It's not suitable for patients with TMD. So we need to address the TMD issues first. Not suitable for patients with severe OSAS or for class 3 high angle patients. And for those patients with periodontal disease. These are the possible sensations that the patient may experience: morning discomfort. There may be brief morning temporomandibular joint pain or muscle soreness, but sometimes this will typically gets resolved within hours after waking up. Now, there might be excessive salivation or probably dry mouth. It can be resolved after a couple of weeks from the beginning of the treatment, or some tooth discomfort because there will be teeth movement, especially for SA+. And that's it for Smartee products. There's more to learn because I would want to share with you the process with case submission, how to approve a case, how to do troubleshooting, how to submit a case successfully. I guess we have to do it some other time. We need about 2 more hours for that.